My name is Sylvia Omulo. I work for Washington State University. I'm based in Kenya, where I work under the Global Health Program in Kenya. Uh, in Washington State University Global Health Kenya, I lead antimicrobial resistance research, and that involves conducting studies to look at general antibiotic use in hospital settings, as well as community studies that address the issue of how much resistance is there and what are the factors that contribute to resistance within those settings. So I submitted my work based on what I call the sanitation study. This study essentially asked the question, in a community setting, is it antibiotic use or is it sanitation that is the main contributor to antimicrobial resistance? Based on the data that I collected as a graduate student, I found that in sanitation poor facilities or in sanitation poor settings, the role of antibiotic use is really dimmed by the overarching environmental issues. It appears as if transmission factors are much more important than individual use of antibiotics. And that's really important in terms of how we think about interventions for antimicrobial resistance in this setting. It simply means that controlling antibiotic use in itself without considering the environmental factors that perpetuate the transmission of resistant bacteria is not a very effective strategy. Without surveillance, we cannot really tell what the burden of antimicrobial resistance is and where specific interventions would be targeted in order to give us the best or to yield the best control efforts in terms of antimicrobial resistance. And this is particularly important in low and middle income countries where health resources are really limited, and so priorities must be set based on some level of data. Surveillance does this very well. It provides evidence, and we can use that evidence to kind of really look at where exactly to direct all these the few resources available. Just based on the research I've been conducting so far, I think in settings such as Kenya, where there's still a high burden of infectious diseases, prevention is the main intervention to target. If we can bring down the number of infections, we do two things. We lower the demand for antibiotics, but you also make sure that resistant bacteria that are already in the environment are not transmitted between person to person or between animals and humans. So the one intervention I would make for sure is perhaps institute vaccines. That's a prevention mitigation, or resolve the issue of poor sanitation that helps with transmission of antibiotic resistant bacteria. Let perfection not stop progress. That's really important to me as an individual, because many times I get bogged down with trying to write the perfect manuscript or trying to pass the perfect message to really capture what I want to say in terms of antimicrobial resistance. Yet sometimes I end up missing the point. I have, I think, 3 manuscripts that are seated at my desk because I'm trying to look at the perfect way to frame them so that I get the message out. That was a very important message I got from today's meeting. Yes.
Brilliant.